Did you know in 1962, a TV show called The Jetsons pictured a boy who tried to use a sick day as an excuse to miss school. But his plan failed as his mom called the doctor, who then appeared on a monitor screen. This proves that the show from 1962 successfully predicted the future of telemedicine we know today. Can we, as educated students, predict the future of healthcare and medicine? My name is Chelzsya Athaayaa Nurman, a third-year student from Bandung Institute of Technology, majoring in pharmaceutical science and technology. And today I will be pitching you my idea on re-envisioning the Indonesian telemedical business to flatten the curve in the COVID-19 era. As you may all know, technology is now bridging the gaps in healthcare coverage. They offer a virtual solution to patients to communicate with their doctor when there are physical barriers, including distances, location, or access. Not only the technological advancements have enhanced the telemedical businesses around the world, but the COVID-19 pandemic has also affected its growth. The pandemic creates a situation where it's dangerous to get medical services, causing the risk of possibly catching or spreading the virus, especially in high-risk places like hospitals. This makes telemedicine a better option to take for patients. In Indonesia itself, the government has encouraged citizens to get treatment and consultation provided by telemedical businesses. Telemedical service providers like AlloDoctor, Grab Health, and Halodoc have experienced exponential exposure and growth since the pandemic. But let's take a look at the bitter reality of the current COVID-19 condition in Indonesia. Hospitals are now at full capacity, and there is a shortage of beds, oxygen tanks, as well as doctors. Because of this, patients self-isolate themselves at home without getting the proper medical care they need. This results in about 2,313 deaths due to COVID-19 outside of hospitals, reported in July 2021. A few factors causing this are psychological impact, limited health facilities, no proper medical care and monitoring, as well as limited awareness. With this major problem going on in Indonesia, and an inspiration I got from the telemedical care provided by one of the hospitals in the Netherlands, I am proposing an idea on a nation-scale integrated telemonitoring business that offers an all-in-one medical care service, oversees and enhances the existing e-health apps. To visualize, design, and test the value for customers, I'm using the value proposition canvas that is composed of customer profile like jobs, pains, and gains, as well as the value map that includes products and services, pain relievers, and gain creators. Now let's take a look at the customer profile. The customer jobs include receive proper treatment for COVID-19, take advantage of telemedical services, as well as self-isolation to minimize physical contact. The pain include unavailable proper medical care and monitoring, lack of knowledge regarding when to seek help, as well as anxiety from hoax in social media. The gains are getting the right individualized medical treatment, monitored prognosis with fast emergency response, and integrated reliable source of medical data or news. Now let's continue on with the value map. The products and services offered are all-in-one telemedical service app, integrated confidential patient database, real-time telemonitoring supervised by physicians and diagnostic device, as well as facilitate patient to nearby hospital available with automated ambulatory system and paramedic motorcycle. Moving on to the pain relievers, they are rapid detecting monitoring device that detect emergency, and in cases of emergency, the paramedic motorcycle will come. Real-time reliable medical data source and easy-to-use telemonitoring medical device, as well as available daily medical consult and mental support. Lastly, we have the gain creators. They are individualized care and personal consultations, rapid detecting monitoring device, and this service can be developed for other chronic disease conditions in the future. The inclusion criteria for this telemonitoring service are COVID-19 suspects or patients with mild to severe symptoms that needs monitoring, age more than 17 years, has a smartphone, and access to internet connection. Whereas the telemonitoring COVID-19 device I'm proposing consists of a pulse oximeter, thermometer, blood pressure monitor, and simple blood test analyzer. It is designed with AI and machine learning so that it automatically updates the patient status to app after it is connected. The innovation of paramedic motorcycle idea is an effective approach to normal ambulance that have trouble accessing small alleys that are common in Indonesia. With this revolution, the time needed to travel and give emergency help will be much faster. Here I listed out the brief telemonitoring service pathway that consists of enrollment, setup, telemonitoring, and end of telemonitoring. And this next slide illustrates the user interface mockup that I created. With this idea, what are the action plans? I've come up with 6 action plans. 1. Collaborate or merge with existing telemedical businesses. 2. Ask support from government to collaborate and make regulations. 3. Work with hospitals or other public health centers nationwide. 4. Design an integrated national medical database. 5. Provide paramedic motorcycle for emergencies, especially in alleys. And 6. Work with experts to make an AI or machine learning-based medical device. In conclusion, the telemedical businesses in Indonesia have a big opportunity to flatten the curve in the pandemic era. The key point to this is telemonitoring with AI or machine-based learning medical devices. I also strongly suggest further research in other aspects for the realization of this idea. Because if a TV show from 1962 can predict the future, so can we. Thank you for listening. Have a nice day.